afternoon. Hi. My name is Ana Santos from LINECARE, and our mission is to innovate the way people have access to medical care. So, upon a trip to the Philippines, our team came into the observance of a few problems, and that was that the actual service for medical care is not as good as we would expect and people would require it to be. So we saw many issues like we can see in the following pictures. People waiting, children and mothers sick, waiting in line for many hours, elderly people, children waiting in line. The quality of the place itself was not the best either. So we saw that there were three main problems. So for both patients and doctors in this community, there was a lack of information when it comes to location, availability, expenses. There was long queues in the hospitals and also inefficient workplace. Everything was very delayed, and the queue time was about 1 to 6 hours. That is pretty ridiculous when you think about it, especially since we are so used to having faster medical care, I would say. Now, there was also the problem of no standard age MR or EMR, which means that everything that was processed based on paper. So why did we see this as a market opportunity? Well, because in the Philippines, there's 22,000 hospitals and clinics, 130,000 freelance doctors, and more than 200 million medical consultations. Not to mention that the usage of internet and the smartphone usage keeps increasing per year. So, with that in mind, we decided to create something that would help both doctors and patients. And this is what we came up with. An app and online-based platform that helps patients, this is the patient version, do a map-based search for hospitals and doctors' information and their respective reviews as well. It also includes online booking, and plus they can check their QE time, the exact number of which they would have to go to the hospital. Plus they could fill in a medical questionnaire to further give information ahead for a possible diagnosis. And they can also leave a review. So, our business model includes a booking commission of 10% with $1 of consultation and completely free for patients, since we know that many of these people cannot afford these consultations. Now, why does this work? We already tested that with a pilot test, and in this pilot test, our results were very positive, and we obtained 3 of them, which were lower medical costs, which were reduced by 15%, less queues in hospitals, from 1 to 6 hours, they were reduced to less than 30 minutes, plus the revenue for doctors using it was of 400 in total revenue, and 60 extra patients per month. We tested this in 15 doctors and 200 patients. Now, this is backed up, and we have gotten support and approval from some institutions and from some awards like the Social Venture Funding, Spring Valley, and many others. And this is our social business model canvas. And again, I would highlight the fact that our value proposition would be not only for doctors, but also for patients, and even including, let's imagine receptionists of hospitals. They could also manage the doctors' schedules. They could do it easily as well. Plus doctors, are not only able to organize their own paperwork and workload, but deal with their patients. And for patients, they are able to efficiently get to the hospital in time and not have to wait so long. Now, our social impacts by 2021 would be to lower medical costs for a get of 5 million patients, extra consultations for 50,000 doctors, plus free insurance for 100,000 children. This means equal medical care for everybody. Now, additionally, we plan to add features such as an AI system, in which all of this will be possible as well, hospital searching, booking, real-time QE number notice, and professional information as well. And I would say our key feature is the big medical data plan. With this data plan, we can not only obtain commercial, demographic, behavioral, but also medical record data, which can be further used for statistical purposes for not only the doctors and the patients, but also for the government or institutions that need so. This could also create a second business model which we could profit from and help the population. Now, the revenue plan is of number of medical consultations to 200 million per year, plus 15% of market share in 2021 with $15 million, and this is only revenue, commission revenue. Now, we also saw our competitors, and we saw into the market, and we found that no other competitors had the same features or offered the same or even a free for patients as LINECARE. And as we can see, LINECARE does offer searching, booking, medical chart, plus free of charge for patients, like not the other companies. And this is our team. I would say we have a very diverse and rich team. And all of us contribute our part. So our CEO, Danny, has experience in startup and business. Plus, we are working with 2 experienced Korean engineer software developers, and they also have experience in medical software development. And our advisors include medical science, public affairs, and business advisors. And also, we also have government connections to the Secretary of the Department of Science and Technology, the Department of Health and Trade in the Philippines. This also means that these 3 departments have been trying for years to come up with solutions for these problems in the Philippines, especially related to medical care. And so they are trying to develop a medical software for this. And for that reason, LINECARE has partnered up with them and has made a memorandum of understanding, which means sort of a kind of a contract to help them develop these sort of technologies. Now, these are our partner doctors that also helped make our pilot test possible, and they include many doctors who also gave a really positive feedback on this platform. Now, this is our roadmap, and as we can see, we do not plan only to stay in the Philippines, we plan to expand depending on each country and their medical needs. So, we do plan to expand further ahead into other countries as well. Thank you very much.